So today we're going to be demonstrating how to get donned up and your doffing process for a patient who is suspected Ebola. We're going to run through the checklist which is included in the Ebola pack, and we'll work through it with a buddy-buddy system. So the purpose of this demonstration, Pete is going to be the nurse looking after the patient and Hannah is going to be his buddy. Okay, so Pete, can you please make sure that you have had all your personal items, jewellery, rings, watches, all taken off. If you're a female, long hair is tied up, or a male. Glasses are secure, you're happy they're not going to fall off. And you've got a clean chair ready to use.
Yeah.
Great. So first of all, you're going to wash your hands with soapy water.
Yeah.
Great.
That's been done, yeah.
Now you're going to put on your foot covers. Ideally you want to be sat down for this, and please note how Pete is tying the foot covers at the front and then round to the back into a bow. And this is going to help when you're doffing. The next part of the process is putting on your first pair of gloves. These are going to be your inner gloves. So the next part of the process is applying your gown. Ideally the gown needs to be long enough so there is no gap between your boot and the gown. And this is where your buddy will help ensure your gown is tied correctly. It is really important to tie a bow so that you're not tying a double knot, so the gown can be adequately removed. With your first inner gloves, make sure that the gloves are on the inside and the cuffs of the gown are on the outside. The next part of the process is applying your hair cover. Now we're going to show you the correct process of applying the face mask, the FFP3 that you are mask fit tested to. So put the mask in your hand as shown, and with these ones ensure the straps are at the front. Put the mask to your face, holding the bottom strap, lift it up over your head. Then secure the second strap. And now your buddy can help ensure the straps are in the correct place. Make sure you pinch at the nose and try and get a firm seal around your face and under your chin. And as shown, do the huff test. If your buddy can open up your face shield for you and take away the protective film. And then don your face shield. Next, you're going to put on your second pair of gloves, ensuring that these pair of gloves are the correct size for you. These gloves need to go over the cuff of the gown. Your buddy can help you get the gloves on. Now you're fully donned, your buddy is going to check the integrity of your outfit. So you're going to be asked to do a couple of tasks. So please extend your arms to forward, bend at the wrist, extend arms up and down to ensure that there's no breach of the PPE. Once you are happy, you're going to get the permanent marker and you're going to write the name and the designation of the staff member on the PPE. show you the sequence for doffing. Your buddy will have a PPE on, but the purpose of this demonstration, she does not have any on. She would have a mask, gloves and gown. Personal checks for your buddy. If the member of staff to be assisted in removing PPE is heavily contaminated with body fluid, the buddy must don PPE. So are you wearing the correct PPE?
I am, yes.
Is there a cleanable chair ready in case it's needed during PPE?
Yes.
So you will need to be wearing gloves. So undo the outside tie of the gown before proceeding to the next step. How to take out the outer gloves. Using a gloved hand, remove outer glove from the other hand, touching only the outside of the glove. Keep hold of this glove using the same hand. Slide fingers of the other gloved hand under remaining outer glove at the wrist and peel off the second outer glove. Discard outer pair of gloves in the infection waste stream. Keep the second pair of gloves on. Instructions for removing the gown. Instructions for the buddy. Touching only the inside of the gown, undo the inner tie of the gown, followed by the Velcro tie. Fold or roll down the gown inside out towards the staff's shoulder level. Nice and slowly, go at the speed of the staff member. Keep rolling, touching only the inside, nice and slowly. And what you want to do is roll it into a ball without flicking to ensure that none of the contaminant is spreading to the area. Roll into a ball and discard inside a linen skip. Removal of the foot covers. Outside the foot cover is contaminated. Use a chair if needed. Touching only the cords, release the tie from the back and bring the cords to the front. Touching only the outside, roll down the foot cover. Then using your contaminated gloves, you can remove the foot cover from the outside, putting it straight into the linen waste. Inner gloves. Remembering now that these are contaminated. Remove inner glove from one hand, touching only the outside of the glove. Keep hold of the glove using the same hand. Slide the fingers of the other hand under the remaining glove at the wrist and peel off the remaining glove. Discard the gloves. Wash your hands and put on a clean pair of gloves. Removing the face shield, remembering that the outside of the face shield is dirty. Pull from the very back, ideally over the waste bin, and gently put the mask straight in the bin. Removing the mask. Front of mask is contaminated, do not touch. Without touching the front of the mask, grasp the bottom tie or elastic from the head, pull it up and grab the top tie. Lift up and remove the mask, remembering not to flick it, taking your time.
That's it.
Pull it up and forward, straight into the bin. Removing your hair cover. At the back of the hair cover, where it's a little bit baggy, pull up and over your head, nice and gently, remembering not to flip, and straight into the contaminated waste. Gloves. Remove your gloves, again, one at a time, from the outside, removing one, holding it with your gloved hand, then the inside, removing the other, into the waste bin. and now you fully wash your hands. In case of staff exposure to Ebola or VHF, if a member of staff was exposed to Ebola, VHF, due to breach in the integrity of the PPE during patient contact, instruct staff to shower after removal of PPE. The buddy must give a laminated copy of the instructions for showering. If shower is not within the immediate vicinity, instruct colleague to change into clean scrubs for the journey to the shower room.